first we're going to take a look at the musculoskeletal system, and I can see that the musculature of Ashley's face and neck, it's all symmetrical, it looks good. So next I'm going to just palpate the temporomandibular joint for tenderness. Does that hurt? No? Okay. So I'm going to have you go ahead and just open and shut your mouth. Does that hurt when you're doing that? No. Okay. So now I'll have you move your jaw from side to side. Okay. And now forward and backward. Okay. Does that hurt? I'm not feeling any masses or tenderness. So now I'm going to have you, now I'm going to just feel your neck and cervical spine for any tenderness. Does that hurt? No? Okay. Now I'm going to just, can you push on my hand? Perfect. And again. And again. And now, perfect. Oh, okay. I'm going to just check your range of motion. So can you put your chin to your chest and now put each ear down to your shoulder? Great. And now look up. All right. Excellent. And now side to side. All right. So next I'm going to check your spine. And we'll just start, we can see from the side, looking at the top of the spine, we see that the cervical area is convex, then thoracic is concave, and then lumbar we're convex again. So I'm just going to have you bend forward at the waist, and I'm just going to check your spine, and it feels straight and perfectly aligned, so you go ahead and stand up for me. Did that hurt at all? No. Okay. So now I'm going to have you go ahead and just, here you go, lean back for me into hyperextension. Okay. And now to the left and to the right. Okay. And then go ahead and rotate for me. Okay. All right, so now I'm just going to check for strength and range of motion in your shoulder. Does this hurt at all? Feels good? Okay. So I'm going to have you, you can face this way, and I'll just have you bring your arm right out in front of you and straight back behind you. Now out to your side into abduction, and then across you into adduction. Now I'll have you put your arm back behind just like that. And up like that. That hurt at all? No. Nope. Feels good? Mm-hmm. Okay. So now I'm going to take a look at your wrist, or your elbow. Does this hurt at all? No. Nope. Okay, so it feels good. There's no problems there. I'm going to have you just bring your elbow up to your shoulder. Okay. And back down. Mm-hmm. Okay. And I'll have you just pronation and supination. And now I'm just going to have you push up on my hand. All right, so we've got 5+ strength. And now I'll have you, I'm just going to take a look at your wrist here. Any bogginess or pain there? No? No? Okay. So I'm just going to have you down like this, and then into extension, and then straight up to the sky. Great. And now radial flexion in, and then ulnar out. Okay. And now I'm just going to take a look at your fingers. Okay. Any pain or tenderness there? And I'm not feeling any deformities or issues with the fingertips. So I'll have you flex your wrist down just to check, and now press up on my hand. Great, 5+. And then for your fingers, I'll have you go ahead and make a fist for me, and then straight out, and then into adduction. Now touch your thumb to your finger. Good. And then make an OK sign for me, and don't let me pull your fingers apart. Good. So we've got 5+ strength. All right, so next I'm going to do the lower extremities, and I would do all of this bilaterally. I'm going to just start by palpating your hips. So does that hurt? No. Okay, great. Now I'm going to check your range of motion. So I'm just going to have you lift your legs straight up. Just one leg.
Oh, sorry.
Okay, and down. Now please bend at your knee, kind of up towards your chest. Excellent. Now across, now bend your knee across your chest, right, and then out to the side. Perfect. And now push up against my hand. All right, perfect. I'm going to have you push against me here. Perfect. So we've got 5+ strength in our extremity. Now I'm going to take a look at your knee. So I'll just have you relax your leg down. I'm not feeling any. Does this hurt at all? Okay, so no tenderness. There's no edema or anything like that. Okay. Now I'm gonna look down to the ankle here. And I'm going to palpate the Achilles tendon here for any bogginess or swelling, which isn't noticed. You can just relax for right now. I'm going to palpate the toes for the same. Any problems there? Great. So those feel fine. For range of motion, I'm going to have you just bring your ankle up and toes up just like that. Great. Which is dorsiflexion. Now I'm going to have you point your toes, perfect, into plantar flexion. Okay. All right. So now we're going to move on to your feet for inversion and eversion. So go ahead and pull up on my hands. Good. And now like you're pressing on a gas pedal. Excellent. So 5+ strength there. Going to check the strength of your knee. So I'll have you sit. Just sit right here on the edge.
Okay.
And now just push against. Okay. And now I'm going to have you push right here. Perfect. And out right here. Excellent. Okay. To check for your knee. Okay. Other way. All right. So now I'm going to check for carpal tunnel and for Fallon's sign. So I want you to put your hands together and down like this. Perfect. So I would do this for 60 seconds, and I'd know if you have any numbness or tingling down here. Are you experiencing any of that?
No.
No? Feels good?
Yep.
Okay. All right. Okay. So the next I'm going to do is Tenel sign. So I'm going to have you hold your hands with your palms to the sky. Just one is fine. So, and I'm just gonna tap your wrist like this. Do you have any tingling or numbness?
No.
Okay, so we call that a negative Tenel's sign.
Okay.
All right. And so now I'm going to move into the neuro portion of my assessment. I can tell by looking at my patient that Ashley here, Ashley here is alert. And do you know what your name is?
Yep.
What's your name?
Ashley Brandis.
Okay, and you know where you are?
Yep, in her apartment.
And where is that located? What town?
Hooksett, New Hampshire.
Okay. And then do you know what day it is?
It's April 22nd.
It's your favorite day.
Earth Day.
Earth Day. Okay. Okay. So, other way. Okay, so moving on here, now we're going to assess the cranial nerves. So to start with C1, which would be the olfactory, Ashley's been assessed in a prior video. She was smelling some flowers. She's got a great intact sense of C1. And then for C2, for visual acuity and peripheral, we've also done that as well, which is within normal limits. So then C3, 4, and 6, assessing the field of gaze, as well as C3, which checks for pupillary size, shape, and constriction. We did that previously as well, and she'd have pupils that were equal, round, and reactive to light without any issues there, and good accommodation. So C5, we check for sensation. So just tell me, can you feel me touching you?
Mm-hmm.
Good. And you can, no issues
Nope.
anywhere. So as distally as I go, she can feel me. To check C7, I want to check symmetry of the facial movements. So first what I'm going to have you do is raise your eyebrows. Great, so symmetrical there. Now puff your cheeks. Great, symmetric as well. Go ahead and give me a nice big smile. All right, so smile's nice and symmetric. We can see the teeth, no problem. Go ahead and purse your lips. All right, and now blow. Perfect, okay, so that looks excellent. There's facial symmetry without any asymmetry or drooping noted. Okay, so to move on, we'll go to C8, which assesses hearing. So the use of the Rhine and the Weber test, which we had done previously in another video, and was all within normal limits. For C9 and 10, we check a gag reflex, which I already checked her gag reflex, which is present. Now go ahead and say ah for me. Okay, so we see a symmetric rise of the soft palate. For C11, we check shoulders for symmetrical muscle movement and strength, which we have just done previously. And then for C12, I want to inspect the tongue here, so go ahead and have you stick your tongue out. So we see the tongue is symmetric, it can move around, there's no fasciculations or tumors there. So next we're going to move on to the motor system. So we'll, when my patient came into the room, I saw that she had a nice steady gait without any need for assistance. So now we'll move into standing up and moving around. So Ashley, I'll have you go ahead and stand up for me. Okay. So I'm going to have you take a few steps walking in a straight line, just like this. You're just gonna walk heel to toe. So you're just gonna walk right like this. Okay. Now I'll have you go ahead and hop on one foot for me. Perfect. Next I'm gonna do the round bird test, just to check for your balance. So I'll have you stand with your arms at your side. Go ahead and close your eyes. And I'm going to stand nearby you so you don't fall. And you go ahead and keep your eyes closed for me. We're going to make sure that she's able to stay straight. She's going to move just slightly, but she'll be able to accommodate for that. And so the round bird test is within normal limits. Next, I'm going to check pronator drift. So Ashley, I'll go ahead and have you put your arms out straight in front of you. Pronation, excellent. And go ahead and close your eyes and just leave your arms there. Okay, so we're checking for any drift, which we don't see. If it was positive, we go down like this, but Ashley's negative. She doesn't have any pronating drift. Okay? So next, Ashley, I'm going to have you, I'm just going to check the coordination of your fingers. So go ahead and just touch each finger to your hand, just like that. Great, with both hands. Excellent. Okay. Now I'm going to have you alternate up and down from pronation to supination like that. Great. And now just go ahead and pick your leg up just like this and slide it down on both sides. Okay, great. All right, so I'll have you come sit back down here with me. I'm just going to adjust the camera here. Okay. Okay, so next I'm going to check your extremities for superficial tactile sensation here. So just tell me if you can feel this. And
Yeah.
Okay.
Yeah.
Okay. Is that sharp or so? Is this sharp or dull? Just tell me which one it is.
Oh, dull.
Okay. You can feel that?
Mm-hmm.
Excellent. So next I'm going to check, I'm just going to grab my tool. Okay, so next I'm just going to use my vibrating tool here to check for a sense of vibration. And so can you feel that vibrating? Yeah. Okay, so now I'm going to have you close your eyes. And I'm going to check for sterognosis. So, I'm going to check for your vibratory sense. So I'm going to make this vibrate, and you just tell me when you feel it vibrating, and then when you feel it vibrating, okay? So we'll just do this.
Feel it vibrating, and it stopped.
Okay, excellent. And I would also do this on your foot. So now I'm going to check for what's called sterognosis. So I'm going to have you just close your eyes and put your palm face up. I'm just going to put an item in your hand.
Okay.
And I'm going to put an item, just a normal item in your hand. You can only use one hand to feel it. And just go ahead and tell me what that is.
That's a quarter.
Okay, excellent. And so next I'm going to do graphesthesia. So I'll use the palm of your hand. You keep your eyes closed. I'm just going to write a number facing you and just tell me what number that is.
3.
Perfect. Okay, so next I'm going to do a 2-point test here. 2-point discrimination test to just, you can keep your eye, you can open your eyes, to check for fine tactile sensation. So you should be able to feel 2 different points. I'm going to use the 2 points I have here. I'm just going to slowly move them apart, and you just tell me when you can feel 2 points. So at first you may only feel 1 point, but then as I move you're going to feel 2. Okay?
Okay.
So go ahead and close your eyes for me. All right. Do you feel 1 or 2 here?
2.
Okay. All right. So, and then I go ahead and measure that to see what length it is that she can feel 2 points. It's usually about 2 to 5 millimeters. Okay. Okay. So I would do that as well, probably up here on your arms, because the length would get further And like for your back, it would be really long, but fine, since like your tongue, tips of your fingers would be narrow. Okay, so now I'm going to move on to deep tendon reflexes. First, I'm gonna start with the bicep. So I'm just gonna find the tendon here. I'm gonna have you keep your arm really, really relaxed. I'm gonna use my finger and the pointy part of my mallet here and just elicit a reflex. Okay, so we got a nice +2 response. Now I'm going to do this for your triceps. So I'm going to have you completely rest your, yep, right there. And I'm not going to use this point, so I'll use the back here, right above the elbow. And we get a little response there, about +2. Okay, so now to do the brachial, we're going to just have you relax, completely relax. I'm going to put my finger right here just to get a little, probably +2 there. Okay. So then I'm going to move on to the patellar reflex. So I would have my patient with their legs swinging, it wouldn't be fully on the ground. So we're just find it right here, and her feet would be off the ground. All right, so we got about +2 there. Next we'll go down here to the Achilles. So what I'm going to do is just dorsiflex your foot and take a little hit to the Achilles, and we'd have a little response there. So now I'm going to check for clonus. I'm just going to press up and lightly let go and let her foot come down. And we would check for any beats, which I don't see, so we've got a normal clonus. And then for the Babinski, we're just going to trace right around the foot. We'll see it go out